Helen Goodman, MP for Bishop Auckland or Weardale? Or?
Thank you very much, Bill. And I want to echo what Jenny said about thanking you for organising this event. Now, of course, as the people involved in the STEP said, in the process said, at the heart of this are people, and everybody's concerned for people. But one thing that worries me is the lack of numbers in the analysis which we've been shown. And I want to focus on really two very simple points. One point is about distance, and the other point is about money. Now, as Jenny has pointed out, there's a big problem for us west of Darlington. It takes 20 minutes to get from Barnard Castle to Darlington. And maybe if you call an ambulance coming from Darlington, maybe it takes 20 minutes to get to you, 5 minutes turnaround time, 20 minutes to get back to Darlington. That's the current situation. That's not the most westerly part of my constituency. The most westerly part of my constituency is the people who live in Langdon Beck. Well, that's another more than 20 minutes because the roads are very bad up there. So we've got these long distances already at the moment, and we've got the big risk factor of the A66 going through, coming over the Pennines and going down to Scotch Corner, where we regularly see big major accidents where people do need immediate emergency care for serious life-threatening trauma. So I think the point about distance is absolutely fundamental to this. Going to James Cook or going to Durham takes 45-50 minutes from Barnard Castle. But again, it takes even longer from up the Dale, from Middleton in Teesdale, from Forest in Teesdale, from all these villages. And when we have done surveys of the people who, in a way, are most isolated, they are people who live around Cockfield, the Evenwood ward, that is incredibly badly served. And that is very problematic because the health problems of people in the Cockfield and Evenwood wards and those villages up there, the health problems that they face are worse because of the different demographic and the industrial background of that community. So we've got a lot of isolated communities. So obviously that is a problem in an emergency. I mean, it's just blindingly obvious. And I don't think there's anywhere else in the region that has got these long distances. So for us, Darlington is essential. And the prospect of going to North Tees or James Cook is just horrendous to people. Not least because if you're going and you're not going by ambulance, most people who live in my constituency are not popping off to Middlesbrough and Stockton all the time. They don't. Frankly, I couldn't even find those hospitals. I don't even know where they are. If I don't know, and I'm the Member of Parliament, my constituents aren't going to be able to find it in an emergency with a screaming child in the back of their car. So it absolutely stands to reason that we are totally dependent on having a good A&E service in Darlington. And that is just basic. That is our number one call, that is our number two call, that is our number 100 call. We absolutely are committed to having the A&E in Darlington. Now, if I could just flip over to the other numbers that I was talking about, the money numbers. Of course, the people here are not responsible for the overall NHS budget. However, there are two things that I think that you could usefully do. The first thing that I think is important is to be clear about what this exercise is. Is this an exercise in managing our local health service given resource constraints? Or is this an exercise in how to fund the best possible health service which is possible given the resource constraints? Those two things are not the same. And I think it's this sliding from one to the other that gives people this feeling of uncertainty about what is going on. What are we looking to do in this plan? Are we looking to improve the healthcare, or are we looking to manage the healthcare given the resource constraints? If it's the latter, and I suspect it is the latter, and I don't blame the people who work for the NHS for that, that's not their responsibility. But if it's the latter, then I think we need to be more honest with the public. So, for example, you know, people get tired of hearing things like, we know everybody wants care closer to home. Oh, and by the way, we're closing the A&E in Bishop, and now we're thinking about closing the A&E in Darlington. Forget it. If you don't want care closer to home, don't use it as a strapline. It's an absurd thing to do. So what is this exercise really about? I think it's really important to be clear. Second of all, I think it's very important that if, as I say, I think it's an exercise in how do we manage a situation with tight resources, and that means that the possible healthcare and the possible health outcomes are not so good, then I think it's incumbent on the people involved in the process to send that message back to the Department of Health. That seems to me to be a completely reasonable thing for you to do. If you say to the Department of Health, well, frankly, we would be able to do this, and this, but actually we would need another 300 million quid, then please say so. And it equally goes for the other elements of the package and the other elements of the resource constraints which you face. So we have very serious cuts to local authorities, and that's impacting on adult social care, and that's impacting on old people, and that's impacting on the NHS. Okay, well then it would be a really good idea to say so. To say, sorry, it's not right that Durham and Darlington have had the level of local authority cuts which they've had, while Surrey and, you know, Dorset have had increases. Say so, because that's the truth of the matter, and that's a major part of the problem we face. And another part of the problem we face in this contextual issue is what's going on in another part of the welfare state, because you've looked and you've considered the interactions between the social care and the health, and that's great. But we also need to look at the interactions between the benefit system and the health system. So every Friday afternoon, I have people coming to my surgery who are expected to live on £53 a week. You cannot have a healthy way of life on £53 a week. Sorry, you can't. You cannot have a healthy way of life and give your children a good start if you have to go to a food bank. You can't. It's impossible. So let us say so. Let us have some honesty in this discussion. Let us say, no, you know, we've got serious, long-standing health issues in this community, and people are being ground down further by what's happening to the benefit system. And if I might say so, there is one practical thing that GPs could start doing, which they don't always do, which is supplying the data to the work capability assessments without charging people for it. Could we please have that as a piece of good practice in our region? Because that would make a considerable difference to a number of extremely vulnerable people. I want to see more numbers. I want to see more numbers for what you're proposing to do. We've had, over the years, a number of issues where assertions have been made, and then we've looked into the numbers and it wasn't quite as it was initially presented. That was true with the closure of maternity services, where I went to the Royal College of Midwives and got a rather different picture about risks at birth. And it's also been true with the long and complex story of the triaging at NIAS. So my plea to you is twofold. On process, I want more numbers and more honesty, and on substance, I think the people in Bishop Auckland are strongly committed to having an A&E in Darlington. Thank you very much.